One of the most overrated structures in the spine is the disc. When people find out they have a bulging disc, or herniated disc, or whatever on their MRI, it's like a moth to a flame. They focus on it and they think that's the source of all their back pain. Where I'm here to tell you that discs are often not the source of your problem, and a lot of problems with discs don't need to be chased after and are normal age-related changes. So let's talk about what is a disc. So a disc is essentially a cushion and a spacer between the bones of your spine. And if you look at the structure of it, it's structured just like a tire on its side. There's a jelly in the middle called the nucleolus pulposus, and there's a ring of fibrous tissue on the outside that has crisscrossing radials, just like in a tire, that forms a nice annular ring on the outside. So just think about a nice bouncy tire between there, okay? Now the other unusual thing about disc is that they're only innervated in the outer 1/3 of the disc. So you can have degenerative disc disease for many, many years and not know what's happening because those inner fibers are slightly tearing and breaking down, but you're not feeling anything until it gets all the way out to the outer 1/3 of the disc. So that's the first thing to remember. You might have a bulging disc, but it's not to the point where it's innervating those pain fibers, so it's probably not causing you an issue. The other thing is they normally change over time. We have a high water content when we're little, and slowly over time we lose water content. So that little jelly in the middle becomes fibrous and it becomes firm, and then from there it can flatten or it can spread, but these are normal age-related changes. So the function of the disc is cushion, but it's also a spacer. So it holds open a structure called the foramen where the nerves exit the spine. And that is where a lot of problems can happen. When a disc bulges, it can touch a nerve. Sometimes it can tear and flip down and touch a nerve. And other times, as it settles, it causes the joints in the back to start to wear on one another and starts predisposing to arthritis. But if you have an MRI and it shows some bulging discs or it has some degenerative disc disease, don't lose a lot of sleep over it because oftentimes it's not an issue. I've seen a number of patients that have had back pain that had discs removed and they didn't have any improvement. And the reality is that probably wasn't what was causing your pain. So main thing I want to get across to you is don't let your blood pressure climb if you hear you have degenerative disc disease. This is a normal process, and it's only at the end stage of the degeneration where you're probably going to have to do something about it. We'll show you a diagram of these things to get a better visual understanding, but I hope you find that useful. Thank you.